Let's take you to Everton, where Deputy President Paul Mashatile is hoping to raise awareness about the global epidemic of tuberculosis and efforts to eliminate the disease in South Africa. He will deliver the keynote address at the World TB Day commemorative event today. Katleho Sekhotho is there. And Katleho, are you standing by to tell us where in the program we are at this hour?
A very good morning, Dudu, indeed. But the latest update is that Deputy President Paul Mashatile will no longer be giving that keynote address, but in his stead, on his behalf, Health Minister Joe Phaahla will be the one delivering the address at around midday today. So that's the latest change in the program. But yes, it is about commemorating World TB Day, and the Health Department, along with a number of NGOs, have actually come out in their numbers to spread the message about, encouraging people as individuals and as a collective to make sure that they understand, taking treatment, being diagnosed, and just understanding that this forms part of South Africa's mandate to reduce the number of fatalities which are linked to TB. As we heard earlier on from Professor Njega, just explaining there, he's the TB National Program Director, just explaining there that some of the challenges relates to people continuing with their treatment and finishing it to completion. But the room where I'm at right now is this is where the situation room of the South African National AIDS Council will be launched along with the World TB Day. They are here as part of the commemorative events. And I have with me Mr. Khumalo, who's the Executive Manager at Digital Transformation, to give us more details. Mr. Khumalo, thank you for your time. Just take us through what is the situation room and how does it work?
Good morning to you, Karabo, and the listeners. So the Situation Room is the platform which is pulling data into a central point. Looking at how the interventions of the country in response to HIV, TB, and STIs, how the different role players come into play, and how data is collected using multiple systems. So the Situation Room comes to collate the data and put it into a central repository, which is then going to be accessed by public, all in aim to increase visibility to how the country is responding to these epidemics, and just to make sure that people get to see how the country is actually progressing in that. And with that, we've seen with COVID how people responded to COVID-19 when they had data visible in front of them. So this is aimed at doing the very same thing with HIV and TB data. So it is very important to have this launched here on this National TB Day, so that people are aware that there is a platform that has been put together by SANA, and that platform is going to make them to be able to access the data that is available and how the country is actually progressing to TB. Yeah, thank you.
And without this data, so far, what have we been doing, and what have been the consequences of the ways in which it helps us, it makes us suffer without the data being collected in this way?
So it has been a bit difficult in the past. When we were doing the consultations for the National Strategic Plan, it came out very clear that people are saying, you come and ask us to make comments on the strategic plan, but at the end of the day, we don't get to see what is happening and how is the country responding and how we're progressing in all of these things. So that's why that it is important for us to actually have that one repository that it paints the picture at any given point in time, so that anyone can log in and be able to actually see what is really going on, just like how we learned from COVID-19. So it has been extremely difficult because this data is collected using multiple data systems. Some of them don't even talk to each other, and some of them not accessible to the public. So we're trying to bridge that gap and making that data available to everyone. Thank you.
So yes, and on that note, who is it available to? Is it for government? Is it for NGOs? Is it for individuals or certain companies? Who can access this information?
Okay, so there are quite a number of dashboards that are available on the platform itself. One targeted at program people that are actually implementing interventions to responding to HIV, TB, and STIs. But there is also one that is going to be publicly available, which is now showing data on HIV, TB, and STIs, and how is the country progressing on that. So that is going to be publicly available as well.
Yeah. Thank you very much for your time. Thank you, Dudu. You heard it there from Mr. Khumalo, the Executive Manager at Digital Transformation, just outlining there the Situation Room being launched here along with World TB Day, but just highlighting that it's a system about collating data and making it easier and more accessible to the public and bridging that gap between information and the public.
All right. right, Katleho, Sekhotho, thank you very much for that update.